Hi.
Hey, we made it. How are you?
Good. How are you?
I'm doing really well. Thank you so much for being here with us today.
Thank you. I'm so excited. I've got some great questions, and I have
Oh,
questions. And
fantastic. Fantastic. So, for people that just joined us, I just want everyone to know um, I'm Shahin Ghadir, a fertility specialist at Southern California Reproductive Center in Beverly Hills, California. And Carson, why don't you let everyone know exactly what you do and where you are?
yeah, hi. So I'm Carson Meyer. I am a birth doula, and I also am the founder of a skincare line called Sea in the Moon, which is a non-toxic, environmentally conscious skincare product. It's one SKU right now. We have a brown sugar body scrub.
Wow, that's fantastic. Okay, great, great. So we're really happy to have you here today. One of the things that really excites me is the fact that once we get people pregnant in this office, they've had so much hand-holding and they've had so much care to get to the point of where their goals have been and been through a lot to get to that point. I sometimes get concerned just handing them off to the world and seeing what happens. So I would love for you to tell everyone what you do for our pregnant patients, when is the best time to jump in, and how all of the services that you do for them helps and what they exactly entail. And I said a lot. We have a long time to go over it all, so we can take it little by little.
Great, thank you. Yeah, so for those of you who might not be familiar with what a birth doula is or does, we are there to support pregnant parents through pregnancy, sometimes even through fertility treatments, preconception, but generally a birth doula works through pregnancy. We provide childbirth education. We are helping clients to kind of know their options, build their birth intentions, find the right kind of care, and really feel supported and as informed as possible going into the birth. On the day of the birth or when labor begins, we usually join clients who are giving birth in hospitals at home first, or we labor with them at home, which is a kind of care you don't generally get. And more we know how important it is to really spend a lot of time laboring at home for a low-risk pregnancy. So we provide comfort measures, massage, aromatherapy, we have a literal bag and then a whole kind of toolkit of other non-literal tools that we bring to the birth space. And then pre-COVID, we would go with you to the hospital or remain there as it comes to a home birth. Actually,
Sorry about that.
not allowed, which is very unfortunate, I think, especially in such a stressful time of so much unknown. I think the role of a doula in that space is more important than ever. But now when my clients go to the hospital, I work with them virtually, where we act as advocates. We make sure that their voices are being heard, their needs are being met, questions are being answered. They know the risks and benefits of certain decisions and interventions that may come up. And then, a postpartum doula usually takes over after that and does postpartum support. But that's
So
kind of the
so important. So
yeah.
I love the fact. I love the fact because I just know how important it is to have support for a pregnant woman during the pregnancy. I mean, that's just a known fact. But after pregnancy and after delivery, when your body is going through a million changes, trying to get back to normal and becoming different as a body, trying to become a source of food and nutrition and breastfeeding, all of that in an incredibly exhausted time after recovery of either natural delivery or C-section is so challenging. So I think it's an incredibly important thing to have that support from someone. But what you said, sorry, go ahead.
Oh, no, just I think what you're saying is so spot on, and also working through pregnancy to prepare for that time is equally as important of having someone to support you through that time.
Yeah, I think that's really important. But one thing you said that I absolutely loved is that I've noticed that some of my patients, not a lot of them, who are coming to my practice for fertility treatments have already hired the services of a doula that helps them go through this entire process. And having someone as an extra support, especially if maybe you are not really open and telling the world you're going through fertility services and treatments, because you don't want people to keep on asking you what's going on when you're pregnant and what is going on. So some people choose not to discuss this with their families. However, finding someone that can help you and is knowledgeable and has helped other people and is a good communicator and supports you in your decisions that are being made in a very smart way with your physician, I think is really, really, really smart.
Yeah, absolutely. And I think to what you're saying, also having non-judgmental support, especially in fertility, right? Where it excites me that we're talking about infertility more and more. I think maybe more than ever. But I think there's still a lot of around, by the way, I would say this with my birth clients as they become parents, right? There's so many people trying to tell you what to do, how to get pregnant, how to, be a parent, how to labor. And then sometimes comes with, really wonderful advice. And then sometimes there's judgment involved. And I think having a birth professional involved in the process can help you have truly non-judgmental support. That's coming.
It's so true.
Place.
It's really true. The other aspect of all of this is that having someone that has been through this with other people in the past, and this is their profession, and knowing the professional way of going through it, gives you a different level of support than what your sister gives you, or what your friend gives you, or what your mom did 30 years ago. So in situations like that, I think having that professional support could be very, very, very valuable.
Absolutely.
One thing I wanted to touch base on is that you're there with these lovely couples and the moms who deliver. You're there as a support system to them once they deliver. Does it ever come up with them, what to do next, or what about next time when I want to have a baby, or things like that? Because I think this is the area that together we can get some great information to people. Because one of the biggest mistakes I hear is like, I wish I didn't wait so much after my first child. I wish I would have come sooner. I wish I did things differently. And sometimes it's too late. Does that ever come up for you and your patients?
You mean like preparing the body for the second pregnancy? Yeah, absolutely. I think, culturally, we've been told as women that after a baby, we need to bounce back, get back in the bikini bod, start losing the baby weight, right? And that's kind of takes priority, aside from obviously caring for your child. But in terms of postpartum care, those are the things that I hear a lot. And what happens, as you know, is through pregnancy, and you're giving so much of your nutrients and energy to creating a human, which is arguably the most, profound thing that the body does. And then you go through delivery where you lose a lot of blood, right? And then breastfeeding where you're giving more and more nutrients to your child. So you come out of pregnancy just depleted by nature. And then we tell new mothers that they have to continue depleting themselves in order to get back to a certain place. When really, and I would love to hear your perspective on this, but the more we nourish and kind of start to heal the body postpartum, probably the better off you are for that second pregnancy.
So isn't it crazy that we're, I think, one of the very, very few cultures that really pushes people the second they have delivered? Oh my God, you look amazing, and you can't even tell you had a baby, and you're back on your clothes and all of this and looking perfect within a week. Yeah. And I think that is such a huge mistake. Our clinic here in Beverly Hills had, before COVID, had about 20% of our practice came from mainland China. And I had 12 different trips over the last 3-4 years that I went to China to meet with patients and give seminars and lectures. And I was invited on multiple hospitals to give grand rounds there. And I realized they have a concept that doesn't even exist in the United States. So they have postpartum hospitals, but it's like a hotel that you go to after you deliver, and you're there for 6 weeks. They help you with every aspect of your baby and everything that is involved in nourishing your body and getting everything back together, to put you back together. And for many people, this 4th trimester is completely ignored. And it is so important. The 40 days after delivering, between 40 days and 6 weeks, whatever you want to call it, has a name. It's called the puerperium. And that time is such an important time that in many cultures, the woman is supposed to lay in bed for 40 days and relax. Mm-hmm. And that's how you make good breast milk. and stay well hydrated, and your mom or your mother-in-law would bring you your baby to breastfeed and take care of the baby while you rested.
Yep. We have so much to learn, especially, I mean, even when it comes to Chinese medicine, like their wisdom around conception and childbirth and postpartum, there's so many valuable kind of traditional practices that I really admire.
I think Rachel is asking, why can't we start that here? And I think that Rachel, who I love dearly, and Carson and myself are now starting $1 million idea about the postpartum hospitals. And I don't want to call it a hospital because it's been made very, very clear to me. Postpartum hotel, okay? With so many hotels being empty these days, I think we're going to be able to do this very easily, where we get a beautiful postpartum hotel that has amazing teams of people that know how to help and have done this so many times. I feel like when you deliver a baby here, like within a day or two, and especially now with COVID around, they are sending people home sometimes the same day just to get them out of the hospital. And that's a little terrifying.
Yeah. I mean, look, I think it's both ways. You know, when you have a home birth or at a birthing center, you're already home, and the midwives leave within 6 hours. In a birthing center, same thing. And I think some people actually like getting out of the hospital sooner, but it's important that when you are home, you have support.
Right. Unfortunately, when you have a baby in the hospital here in the US, like every 30 minutes, hour, someone is in your room, taking your blood pressure, taking your temperature, checking your bandage, and it's like zero rest. And I remember that really clearly when I was in the hospital with my wife.
Yeah, they're not really on your schedule.
No, they're not on your schedule. I remember when a resident came in at like 5 or 4:30 in the morning to check my wife's wound, and I'm like, I don't get this. I understand that you have things to do today, but this is a resting woman trying to recover after childbirth and C-section, and it's really scary.
Yeah, there's the whole thing feels upside down at times. For sure.
Yep. Why don't we go through some of the questions? I see one while you're looking yours up, Carson. I'm going to answer the one that says, after ectopic pregnancy, is it harder to get pregnant again? Well, an ectopic pregnancy, for those people that may not understand what it is when a pregnancy gets stuck in the fallopian tube or anywhere outside of the uterus, which is a normal location. And it's not necessarily harder. However, if it is in the fallopian tube and the fallopian tube was removed as a treatment, well, yes, it is harder because you only have one fallopian tube now. If it was in the fallopian tube and as you were giving medical medication, such as, for example, methotrexate, which kind of helps dissolve a pregnancy, sometimes some scarring occurs in that location. And also for women that have had ectopics, there's usually a reason why they have an ectopic pregnancy, which is either due to a prior infection or scarring of the fallopian tubes. And this isn't a really important thing because if it happened on one side, you have a chance that it happens on the other side. And also you have a chance that potentially that's an issue moving forward as well. So in some ways, yes, it can be harder getting pregnant.
Is there a way to prevent that? I know you mentioned there's usually a risk factor, but...
The ways to prevent an ectopic pregnancy, there's nothing you can do about it unless you avoided trying to get pregnant naturally and you did treatments such as IVF, where we take the egg, we put the sperm, we make an embryo, and then it goes in vaginally and we release it right smack dab in the middle of the uterus with what's called an embryo transfer. In a situation like that, you have much better control and you avoid the fallopian tubes altogether.
I've also heard that IUDs can result in ectopic pregnancy.
If you have used an IUD, for some people, if the IUD has been there for a long time, or if there was some inflammation, or if there was some kind of infection while the IUD was in place, in the future, when you're trying to get pregnant, pregnancy may not implant right in the location where it's supposed to, and can kind of move to an area such as the fallopian tubes and cause an ectopic pregnancy. So yes, but most of the time these days, the IUDs that we have around are very safe. They're put in very clean, and the chances of getting an infection or a problem with them or complication is very, very low.
Awesome. Somebody asked me, how long have you been a doula? 3.5 years now. So yeah, I'm a newer doula, but I've been doing this work since I graduated from college.
That's great. do you have any desire to have your own kids?
I do. Yeah, one day. I
So I think we should address that for women like yourself that are professionals and their careers are exploding and doing incredibly well. What does someone do to make sure that they can have a child in the future without any difficulties? Is this something that comes up in your mind or with your friends or in anyone that you want to kind of relate to?
Yeah, I mean, I'm 26, so I'm kind of at that point where I'm still on the younger side of this conversation. So I have some friends who are like, kids, what? And then some who are, thinking about it, planning it, getting pregnant, or in that age range. But I think for my clients, more and more, and I'm sure you are as well, seeing more people getting pregnant later on. I'm sure I would love to hear your advice too. I know I'm fascinated by egg freezing, but and want to hear more about it because I don't know much.
So
and I
think
have done it, but for me, like what I talk to my friends about and is really the preserving of your health, right? And this idea that we're born with the amount of eggs that we have, right? Where our eggs are in our mom's in utero. Our eggs exist through our mom, and so how the generations of health in womanhood is so crucial, and it starts literally at birth. And so I think a lot of people think, okay, I'm getting pregnant now, I'm going to be healthy, or I'm pregnant, I'm going to start being healthy, or cutting out this and doing this, when really it should be a lifetime.
Right.
And I think because of our environmental health crisis, I would call it, it's even more important to kind of live in and promote that physical, mental, emotional health.
So you said it really well. First of all,
Froze. Oh.
Females as they are in utero. So you have your peak amount of eggs when you are about 20 weeks pregnant. So the fetus that's inside of you when is 20 weeks pregnant, your female fetus, has about 20 million eggs. 20 weeks later, when the baby is born, that number is down to about 2 million already. Wow. So they're unfortunately dying off.
First period, right? They get a period.
By the first time you get a period, let's say age 12 or 13, your eggs have come down to in the 400,000 range. And every month when you release that one egg when you're ovulating, unfortunately, there is still a process where about 1,000 to 2,000 eggs are dying off just by your body trying to ovulate. Wow. So that ovulation process kind of unfortunately gets rid of lots of eggs as well. So it's something that it continues and continues until you hit menopause, and then you kind of run out of the eggs. What we do with the egg freezing process is we encourage people that don't want to have a child anytime soon, but they know for sure they want to, in order to protect your future and to know that you're going to be able to have kids. The younger and the healthier you are, when you freeze your eggs, you have a much, much, much better chance of doing well and having a potential to use nice, beautiful, healthy eggs to make your embryos in the future. So maybe 26 for some people may be considered as too young. But I do tell people that once you've hit 30, and if you don't have some serious plans of having a baby or your family in the next couple of years, that you need to give some thought to freezing either an embryo, or if you have a partner, eggs, or if you have a partner, some embryos. If you have a plan of having 3 or 4 kids in your life, and you think that you may be wanting to have kids in your late 30s and as you approach to 40, that's another reason to kind of safeguard your future and have eggs or embryos frozen as well. The process of freezing the eggs is rather simple. And what it does is it gives you about 10 to 12 days of injections that go into your belly. We teach you how to do them. They're very little needles, and we teach you the entire process. You have a calendar to follow. And during those 10 to 12 days of injections, they are stimulants of the pituitary gland, kind of give your brain a little stimulant. It gives the ovary a signal, and then the ovary starts to make eggs by producing its own estrogen. We are not injecting hormones into people's bodies. And that's a myth that I need to always clarify, because we're not injecting hormones into anyone's body. That's one thing. During those 10 to 12 days, as the eggs begin to grow, we're called follicles, they grow. We bring people back about 4 times to see how these eggs are growing and how these capsules are growing. And during that time, once we get to a certain sizes that are about 20 millimeters for the follicles, we take them under a really light sedation in our surgery center. It takes about 5 minutes. And the eggs are retrieved with a vaginal ultrasound with a special needle at the tip that helps us retrieve the eggs one by one. And then they go straight to the IVF lab. And then the eggs are either frozen or they're introduced with sperm when we're trying to make the embryos. So those are the 2 ways of making eggs and the embryos. And honestly, I made it sound really simple, but it is very simple. And I don't want to make it any harder than that because it's really not. It involves 10 to 12 days of injections and then the eggs coming out. And if that can save someone's fertility for the future and allow them to have the number of kids up to the age that they want, I think it is a very empowering movement for women.
And for somebody who maybe is planning to have children on the earlier side, and is confident, that because of that age that they're in a good place to not be freezing eggs, what are some ways that, like lifestyle, diet?
Absolutely. So
recommend
natural, healthy things to do to make yourself robust and ready for childbirth and pregnancy. I think being as healthy as you can be is very, very important in terms of trying to prepare your body for pregnancy. So I tell people 1 to 2 alcoholic beverages once or twice a week. I tell people that honestly, like smoking is one of the worst things for sperm and egg quality.
Marijuana as well, or just?
That was my next one. Yep. Marijuana has been shown. We know it's legal in the state of California. So there's nothing wrong with doing it if you want to. However,
it's in other areas.
That's true. It does have negative effects on egg quality, and egg quality is irreversible.
And sperm.
And a big, big, big quality issue for sperm. And sperm can regenerate, and you can get new sperm 3 months later. So you can take a break, which 3 months in a female's life is a lot.
That sperm gets that second chance.
We get a second chance. Unfortunately, it's not equal grounds at all. It's not an equal ground at all, unfortunately. But yes, those eggs get this damage, and it's nothing that can go in and like clean up the eggs again and make them more youthful. Also, being on some antioxidant supplements or foods that are very high in antioxidants is really helpful. The antioxidant that we recommend is CoQ10. The pure form of CoQ10, which is considered to be ubiquinol, is a really good one. And we recommend that for a lot of people. Even up to 600 milligrams a day, it's a really good one.
Would you start right before wanting to get pregnant, or you could start this years before?
I think if you're not ready to have kids, it's one of those supplements that can hold on to your eggs and slows down the aging process of your eggs. So I would take it and it has benefits for your entire body, not just your eggs.
Very cool.
I think weight is also an incredibly important issue, in fact, that people kind of neglect because there are many people that are overweight and get pregnant very easily. But then again, there are a lot of people that are overweight and have struggles to get pregnant. And it's the one thing that you can try to take care of at home while dealing with this and trying to get yourself prepared for pregnancy. Being overweight and going into pregnancy has much higher chances of gestational diabetes, preeclampsia, which is like high blood pressure of pregnancy, and to some extent, even preterm delivery. So those are things that I find really, really important.
Thank you.
Yeah.
So informative. I think there's so much, and like I mentioned before, even environmentally. I want to hear 2 questions. One is I think there's so much emphasis and pressure put on women to be able to conceive or through the fertility process, but oftentimes it's actually coming from the male, or right, in terms of sperm quality, sperm count. What are some tips for men?
So just to answer a couple of questions that's coming through, CoQ10, CoQ10 is the antioxidant, CoQ10. There's a pure form of it called ubiquinol, and the ubiquinol is the recommendation to take. So that's one thing. The reason I brought that up again is because it also helps men. Women are recommended to take 600 milligrams a day. Men are recommended to take 200 milligrams a day. And on my Instagram page, there's a very recent post that puts those names of those supplements. So if you can't find it, you can go to the page and definitely see it there.
After this too. So.
Yeah. So that's those are the supplements. Now for men, excessive heat, anything that takes your
temperature.
temperature.
What about sauning? We're obsessed with sauna.
I know. So steam rooms, saunas, jacuzzis, hot baths, a lot of cycling, anything that takes the testicular temperature up significantly is not good for men.
But can be reversible. Like, right, like if you're not in a phase of wanting to.
If you're not in trying to phase of doing any of that, you can definitely take a 3-month break, and your sperm quality should be going back to your baseline.
Okay.
So again, men are very lucky. There are some supplements that men can take in addition to CoQ10 that actually have a lot of amino acids and proteins in them that are really good for sperm swimming motility, the sperm count, the look of the sperm, which is called morphology. All of those things can help significantly.
Okay.
One thing that I like to do when I do a consultation with patients is go through everything. Men, male, female sides, everything that I think they're doing wrong, anything that I think they can have improvement on, or just things in general that potentially can help people. I did want to let people know that if anyone is interested, we do have webinars. Southern California Reproductive Center, which is my clinic. We have these fertility webinars. We used to do them live seminars, but now we do them as webinars. And I think it's just going a lot better for people to be able to, in the middle of their day during their lunch hour, kind of jump on and watch. You can go to the SCRC IVF.com and enroll. They're completely free, and anyone is welcome to listen to those webinars. And we go through a lot of this stuff in a lot more detail as well.
Amazing. Another thing that I've learned a lot about is healthy fats.
Oh, absolutely.
Right.
Oh, especially for
you mentioned being overweight, but I think a lot of women also are underweight, and it's important to also to have, you know, a kind of a balanced body weight, but also to be eating those healthy fats like avocados and grass-fed butter.
Oh, thank you so much for saying that, Carson. I think one of the other biggest challenges we have are women that are really underweight, exercising excessively, and have no real fat on the body because the body needs it. And thank you, because there are a lot of healthy fats out there that people can be digesting and incorporating in their diets, especially before trying to get pregnant, and again, while breastfeeding, because no one wants breast milk that is like my water, okay?
Yeah, that's the reason, like low-fat breast milk is...
Yeah. Babies need fat, and that's how their brains grow, and that's how they grow, so that's really, really important for them as well.
On that, I asked some of the questions that...
Yeah, absolutely.
I think this one is a good kind of tangent to what we were talking about. So I think with the fear of infertility, because we know it's a rising issue, I'm sure you get people who are like, we tried once, we tried twice, right? Or, you know, and maybe perhaps think that they might have a fertility issue, and perhaps it might take time. What is the regular time that might be kind of in a safe zone of not being concerned about fertility, that you would tell people, just keep trying at home, don't worry? And at what point do you think?
So I can tell you that I've never seen a downside to a consultation. So if you're concerned, whether it's been 1 month, 2 months, 3 months, or 10 years, you need to consult with someone who's a professional. Even if it's too early, I'm the first to tell someone, listen, you're really young. Let's just assess your fertility. And if things look good, you have a chance to try on your own. And these are your options for either freezing eggs, freezing embryos, or what you could do or not do. I love to present people with the smart way of looking at things and allowing them to make the smart decision that's right for them.
Yeah.
So if you are, the American Society of Reproductive Medicine has it like really black and white, okay? If you're under 35 and you've been trying for 1 year, you need to seek the fertility assessment with a fertility specialist. And if you're over 35, after 6 months, you should be seeking help.
So, just to reiterate for people, like if you're trying for 1 year or 8 months or 5 months, there's no need to be necessarily concerned, right? Sometimes this process takes time. I mean, I think on a more spiritual level, I feel like sometimes, you know, timing, but also the babies decide, right? That there's...
I agree with that 100%, but I'm going to add a but there, okay? if you are 39 years old and you want to have 3 kids and you have no kids so far, I would 100% not wait for your 6-month mark to call a fertility specialist, because I think you're hurting yourself tremendously. Because you should be making your embryos, you should be saving all of your embryos so that even if you get pregnant easily right now at 39, when you start in the beginning, your baby 2 and 3 are there waiting for you for the future. If you are, however, like 26 and you decide to start, and it's really like 6 to 8 months. Now, this is LA, and we have people that after 2 months are running to our office saying, I don't know what's happening. I need to do IVF right now. And I don't agree with that at all.
Yeah, I think we have a collective anxiety for good reason, right? Fertility is on the decline, and we also, I think, don't always have a trust in our body. And there's a time and a place, right, I think, for this support.
And also because people are a lot more open about their fertility. Everyone has that friend who struggled and struggled and struggled for years, and no one wants to be that person. So that's a really important thing to address. But if the underlying problems, for example, okay, and this is why I don't mind being a little bit more proactive. Let's say you just don't know what's going on and it's not happening. Getting a sperm analysis and making sure they're sperm.
Yeah.
And something simple like that can save you trying for 1 year when there was no sperm or really poor sperm. I think that's smart to know in advance, and it takes 1 hour to go somewhere and do the sperm analysis and leave and be done with it for a long time. And doing a quick blood test that assesses your fertility level and kind of reassures you that you're doing well. I think reassurance also helps people. And once they know things are good, takes some pressure off, and before you know it, things can happen magically. And if not, then I think it's really smart, if any of those testing do come back, unfortunately, showing an issue, then to address it. The other person that's at home that I don't think should be waiting or not doing anything is if you know there's a problem. If you know your periods are very irregular, if you know you're not getting regular cycles, those are things that waiting a year or 6 months or whatever it may be is complete waste of time, because you're going to need some intervention and to figure some things out sooner than later.
Yeah, and I'm so glad you said that, because I think more and more we're talking about periods as a way of indicating our health. And so many young women spend a decade on birth control. They have no idea what their cycles are like, and it could be a very indication. And sometimes you might need fertility treatment, but sometimes it's a diet change, right? Or supplement.
Absolutely. Absolutely.
Or to detox from the birth control. I do the Daisy fertility monitor as prevention, but a lot of people also use that to get pregnant. And how important it is for people to know when they're ovulating, when they're trying.
I think so. If you're just about to start trying and you have regular periods, please don't start using ovulation predictor kits. If you're young, you're healthy, and you're just about to try, and you have very, clockwork cycles, just starting around day 10 of your cycle, every other day, just have sex and it'll happen. Now, if you are hesitant or it's been a while, then I think you should know exactly when you're ovulating.
Yeah.
And the way you do it is so simple. By checking an ovulation predictor kit in the morning, you can start on day 8, 9, or 10 of your month and your cycle and see when you're ovulating in the morning, and that night is a perfect time to have intercourse. So I think there's a lot of ways of being proactive about it without stressing about it. And to be very honest, I'm not an alarmist in any way. It's the complete opposite of what I like to do when patients come in and see me. And I think that's been huge for my practice. I think when I have patients that come to me from other clinics where they're like, there was something, I just wasn't jiving or getting along, and I just got scared about everything the doctor said. It is not the field of medicine that you want to be instilling fear into someone.
Well, trust is such an important part of the process.
100%. Thank you. It's trust.
Yeah, then that gives them permission to believe in themselves. And I think that's a big missing piece, which is why meditation has actually been linked to more successful IVF and fertility, right? I
love that, because I think that the power of the mind when it comes to fertility is so important. I had a patient of mine today that was like, well, what if I was putting beautiful embryos, and she said, what if it doesn't take them? When can I do it again? And I said, I'm walking out of the room right now. This is not the discussion we're having now when I'm putting 2 beautiful embryos in you. And I want you to imagine and visualize yourself getting pregnant so it will happen. And it's something that is so incredibly important important for me and my patients. And I like to exude this kind of positivity. And that's why I love the idea of support from someone like yourself, whether it's during the fertility process or once they're pregnant. And all of those things are so incredibly important to bring the positivity. Whether it's meditation that calms you and puts everything together for you, or a run, or, you know, just going and looking at the waves. Yeah.
And the same thing for birth, right? It's like we need the medications at times, right? We need medical intervention at times. We need like all of these wonderful tools that we've created. Not, you know, not always, but some people do. But to bring that together and use them together for like optimal safety and health, I think is so valuable.
Absolutely. Absolutely.
One more question I have on my end, and I see we have questions here. Somebody said, what kind of fertility monitoring would you recommend for somebody with endometriosis who wants to get pregnant in their future?
So I think the first most important test for anyone with endometriosis is making sure that the endometriosis has not caused significant scar tissue internally, and getting what's called a hysterosalpingogram, or an HSG, to make sure that the uterus looks good and the fallopian tubes are completely open and doing really well. So that's an HSG is the first starting point for anyone concerned about endometriosis having scarred their fallopian tubes or damaged.
Thank you.
Yeah, I think that's really important. Really, really important.
Great. This is so informative. I know I'm like learning so much from you. And I heard you on Dr. Berlin's podcast a long time ago.
Oh, Dr. Berlin's great.
Amazing episode.
Thank you. He is such a good doctor. And again, you know, I love the idea of massage by someone who's experienced and knows how to do it and can calm people down and make them feel better. A lot of my pregnancy patients, including my wife, have seen Dr. Berlin. While my wife walked in limping of pain, back pain, while she was pregnant, and walked out and never had another problem with that issue for the rest of her pregnancy.
Incredible.
So,
and fertility, right? Like sometimes it can be structural. Can you talk a little bit about that?
Yeah. So listen, you know, I'm licensed and I do HSGs here in the office.
Yeah.
I've had patients that went to like fertility massages. I don't know if I have a lot of faith in that, because I don't know if massaging the uterus or a fallopian tube opens them and fixes them. I don't believe that. But I think that an adjustment or something that relaxes the pelvis and allows blood flow to come down to that area and really relaxes the body. Now that's key, because when you have a relaxed body and a relaxed pelvic floor and a relaxed uterus and blood is flowing through, I think it's a really, really nice opportunity at that time to be able to kind of put yourself at the peak of fertility.
Which is kind of the principle behind acupuncture, which is also evidence-based for supporting fertility, right?
Absolutely. But I think there's a lot of information that is helpful that's not necessarily evidence-based, done in studies and done in research and laboratories that we can take that don't harm us in any way.
I totally agree. I think we need to like learn how to break away sometimes from just having, because I'm sure, as you know, you can have a study on the same thing telling you two different.
100%. I told a lot of my patients, you can find a study that says whatever you're looking for the answer. So if you're looking for, like, you know, is water good for you or is water bad for you? I promise you, if you went on, you can find both studies.
And through COVID, I think that's been such a big lesson. It's been humbling to be human in this time and sit in so much uncertainty. And just
I think for many people, and now it's like a reoccurring theme and comment, that the beginnings of COVID and us all having to stay at home really caused such significant calmness in our lives.
Yeah.
With at the same time, unfortunately, some scariness, but some significant calmness of just being home, calm, and just relaxing and just putting a little rest on our lives, that it made us realize what we were really missing. Now, forget all of the unfortunate, sad things that have come with people becoming ill. However, it's a very important thing to understand that being calm, cool, collected, sleeping well, eating well, exercising, and having control over your body and your mind is incredibly important.
Absolutely. Well, thank you so much.
It's been a pleasure. Thank you so much for being on it. I wanted to say one thing before we let everyone go. What I wanted to say is that we are having a special right now because of COVID, and I know that it's hit many people financially horribly. A summer special for egg freezing. It's the lowest we've ever come in. It's right now we're having a special for $6,400, which we used to be over $10,000. For anyone who's interested, I don't know when it's going to end exactly the dates, but letting people know if they're interested in that, we're available. And I wanted to thank you so much, Carson, for talking to me today. It's been actually an amazing pleasure.
Oh, thank you. And once you get pregnant, check out the virtual prenatal circle I'm offering in this time as well. And
I love that.
Out for extra questions or doula advice, I'm right here. So thank you. I really appreciate it. It was such a pleasure to talk to you.
Thank you so much, my dear. Have a wonderful day. Thank you, everybody, for watching. Have a great rest of your day. Thank you.